The patient was taken to the operating suite and placed in a supine. Is it supine?
Supine. Speak up. Can't hear you.
Supine position, and given the benefit of general anesthesia, then rolled to a lateral decubitus position with the right side on the pegboard positioning device. The right hip and leg then received something alcohol and chloroprep, followed by draping in the usual sterile fashion. An incision was established along the anterior lateral position of the greater
trochanter.
What?
Trochanter.
Wow. After modified technique of the Hardinge. Sharp dissection was carried to the subcutaneous tissue. Cautery was okay.
Say bye-bye.